Hello, I'm Dr. Stephen Castor. I'm the Chief Medical Officer at Menorah Medical Center, and I'm your host of House Calls, which is where we interview physicians at Menorah about topics that are important for those in our community. Today we have with us Dr. Tann. He's a board-certified general surgeon and fellowship-trained bariatric surgeon who's here to talk about endoscopic sleeve gastrectomy. Dr. Tann, welcome. Thanks for joining us.
Thank you. Pleasure being here.
So there's a lot of different ways that patients can undergo procedures or surgery for weight loss.
Yes.
Can you describe what we call the ESG?
Yes.
And how that works?
Yeah, so the ESG, the Endoscopic Sleeve Gastroplasty, that's something where it's very, very minimally invasive. And I say very, very because we have a lot of minimally invasive surgery that we do. We still do the gastric bypass, the gastric sleeve, and the duodenal switch, which are all very major operations. Even like a gallbladder. Those are all done minimally invasive, but this is just done through the mouth. So we put a scope down into the stomach, and when it's down inside the stomach, we look at the stomach, make sure there's nothing that we are concerned about, and are able to suture up the stomach from the inside. And so we take this large cavity of the stomach and then we turn it so it's more tubular and sleeve-like, just from the inside with stitches. So that at the end of the procedure, ideally what we like to see is basically the same thing we see if we were to scope someone after they get a surgical sleeve. See that nice tight tube so that they get the same benefits that they get from other surgical weight loss procedures like the gastric sleeve.
Great. Who would be a good candidate for an ESG?
So folks that are good candidates are typically going to be someone with a more mild disease. It doesn't have the same, with a gastric sleeve, we're looking at like 60% excess weight loss on average. With the ESG, we're looking somewhere in the 25% excess weight loss. So people that have a mild disease in the 30s, like a BMI of the 30s, maybe low 40s, or people, specifically folks that don't have insurance coverage and are going to be looking at a self-pay option of any kind. And so when they're looking at that, I mean, that's between $13,000 and $20,000 for a cash pay for a sleeve or a bypass. And if they can qualify for an ESG or be not contraindicated, it's only about $9,000, and that includes insurance coverage for 2 years after the surgery, as well as nutrition visits through the whole year after surgery.
What type of recovery do patients with ESG typically undergo?
Most folks go home that same day. Possibly the next day if their nausea is too much. And when we're suturing the stomach, it has to learn how to do its constriction and movements with those stitches inside. And so we like to just make sure that they have good nausea control, but most folks leave that same day. In terms of how they feel afterwards, again, not a lot of pain, but sometimes some spasms, so that we give them spasm medicine and nausea medicine, and they do quite well.
Great. Any other side effects that you typically tell your patients to look for?
Those are pretty much the main side effects, is nausea and sometimes a little bit of pain or spasm. That's the main side effects.
Great. And what kind of follow-up do typical patients have after the surgery?
So I see everyone in a week. And then usually monthly after that, and those are usually combined with nutrition, which is included in their cash pay price, that allow us to monitor their diet, monitor their exercise, as well as help them develop and reach their goals, and specifically mold and shape their diet. And I'll usually start intermittent fasting with them, usually around 2 months after surgery. Like to give their time and body time to heal, and then we move to an intermittent fasting regimen at around that 2-month mark.
And how fast do patients typically lose weight with this?
Similar to when we do other surgeries. So we like to see most of the weight come off in the first 9 months. And so a lot of that's going to be in the first 3 months. So really we like to look at that 1 month mark and say, all right, now where are we at? The first couple weeks, you're up and down, your body just had surgery and it's recovering. So at that month mark, we like to see someone, around 10 to 15 pounds down, usually in that first month.
Great. Awesome. Well, that's all the time we have for today. Dr. Tann, thank you very much for joining us. For those who would like more information, please check out our website at menorahmedicalcenter.com. Thank you for joining us.